Hey everyone, Kristen here. This is a first for us. We're excited to share a preview of Mayo Clinic Press's new audiobook, Face in the Mirror, the story of the first face transplant at Mayo Clinic. If you want more of the story, tune into our latest episode, get your own print copy of Face in the Mirror from Mayo Clinic Press, or listen to it wherever you find your audiobooks. And now, on with our audiobook preview.
Traffic was sparse in downtown Rochester, Minnesota. It was a June Saturday, and even before dawn, the day was gathering the warmth and humidity of early summer. Inside Mayo Clinic Hospital, St. Mary's campus, the air was cool. A large surgical team had gathered quickly in response to calls and texts asking them to report in for work. A quiet, intense energy hummed in the atmosphere. This was it. The moment they had been training for over the past 3 years. Just days earlier, Andy Sandness had traveled alone from his home in Wyoming to Mayo Clinic in Rochester. Standing outside the sprawling brick walls of St. Mary's, he did not know what to expect. Inside the building, he was greeted by Dr. Samir Mardini. The plastic surgeon was waiting for him in a pre-operative room. They had known each other for about a decade, since 2006. Shortly after, Andy had shot himself in the head but survived and was left with a grievously wounded face. After supervising his patient's prep for surgery, Mardini gave Andy a final consent form to sign. Andy affirmed that he fully understood the risks of the extraordinarily complex surgical procedure he was about to undergo. A face transplant, never before undertaken at Mayo Clinic. He signed without hesitation and, it seemed to Mardini, with evident composure. "Is this something you're sure you want to do?" Mardini asked a final time. "If so, we're ready to go." Andy replied, "Yes, I'm ready." Over the past few years, they had spoken many times about what was coming. Now there was nothing more to say. Andy and Mardini hugged. Their emotions ran high, but they shared an inner calm. After working hard to reach this stage, both men felt ready for the hard work ahead of them. As Andy waited to enter the operating room, he said a little prayer. He prayed for himself, for Mardini, for the Mayo Clinic team, and for the family of the brain-dead young man, nearby in the same hospital, whose face soon would become Andy's own. Mardini walked alongside him as staff members pushed him in a wheelchair toward the operating suite. Wanting to lighten the mood, the surgeon, who would use his entire medical training in this surgery, pulled out his phone and showed Andy a video of his own 2 small children playing. Together, they entered the operating room where Andy's transplant would take place. In the adjoining suite, the preparation of the donor was beginning. Mardini turned to his patient. "We're looking forward to seeing you with a new face," he said. Years later, Andy remembers climbing onto the operating table and beseeching the nurse, "Please don't let anything bad happen to me." "Don't you worry about that," she replied. She grasped his hand as Andy drifted into a chemically induced sleep. He would not fully awaken for 10 days. Watching Andy, the nurse thought, "Wow, we're here. Andy's here. We know this is the right thing to do." All involved in the surgery knew their role in what was to follow. Of the hundreds of procedural steps ahead, each one had been thought out and rehearsed many times. On the way to this momentous day in his life, Andy had already experienced the gamut of human emotions, from deep despair to soaring hope. Nearly a decade had passed since he had attempted to take his own life. His great regret for doing so did not erase the depression that had led up to the attempt. And although he was glad to be alive, he was left with a disfigurement that was painfully obvious to him and the rest of the world. More than anything, Andy wanted to look and feel ordinary. He wanted to walk into a room and talk to people without anyone scrutinizing his face or asking him awkward questions. He wanted to cast away the clumsy prosthetic nose that required daily cleaning with a toothbrush. He wanted to eat like he used to. He wanted to swim. He wanted to kiss. When Andy first learned of the possibility of a face transplant, His response had been an enthusiastic endorsement of the idea. But Mardini had urged him to slow down and consider all that could happen, including the possibility of failure. At times, the complexity and high stakes of the surgery had made Andy waver. Once, after a 3-day stay at Mayo Clinic, pondering all the information he had been presented about the procedure, he decided he did not want to go through with it. The risk was too great, and he felt overwhelmed by the magnitude of it all. The operation would demand too much of him, and a bad outcome would be disastrous. If Mardini could not successfully graft the extensive network of new tissue onto Andy's skull, Andy might be left with a large gaping hole in his face. And if Andy's body rejected the new tissue, he could expect endless dangers and complications. Sensing Andy's uncertainty, Andy's father pulled him aside and asked if he really wanted to walk away from the possible future he yearned for. At his next evaluation, Andy felt more upbeat. He considered himself a good candidate for the procedure. He had the support of his family and was in excellent health except for his facial disfigurement. His tally of the pros and cons of undergoing the surgery made clear what the operation might allow him to do that he could not do now. He might recover full functioning of his lips, teeth, and nose, and his appearance could greatly improve. Or perhaps not. That was the uncertainty. The results of a face transplant varied wildly among the small number of people, just over 3 dozen, who had undergone the procedure. Afterward, he might not be able to smile, close his lips, or speak intelligibly. He might continue to look disfigured, just in a different way. To make the surgery a success, both before and after the procedure, Andy would have to maintain a physically and mentally healthy life, show resilience, overcome daunting obstacles, and above all, develop optimism. Regardless of the efforts of the people whose labors were set to synchronize in a vast medical symphony, only Andy could give himself what he needed to live a fulfilled and happy life. He had decided to move ahead with preparing for the transplant. On this day, Saturday, June 11, 2016, Andy was on the brink of a new life. He felt ready. The massive surgical team assembled to treat him was also ready. Next door was the other young man, the donor, whose organs were being kept alive by medical machines. The procedure began. Soon there would be no way to turn back. In total, about 50 doctors, nurses, and other Mayo staff prepared to spend the next 56 hours giving Andy a new face, his second chance. Would the vastly complex surgery transform Andy's life the way he hoped? By 2006, Andy, now 21, was working full-time as an electrician apprentice at Statewide Electric in Casper, Wyoming. He stayed with his mother in Newcastle on weekends. People who knew Andy saw him as well-liked, kind, and friendly, but also believed he was drinking more heavily than in the past. Few knew he was consuming at least a fifth of hard alcohol daily. He presented a positive picture to Rhonda, however, lying to her by saying he was avoiding smoking pot and refraining from other drugs. 3 days before Christmas in 2006, Andy spent the evening with Reed. They had recently been getting along well, and Andy felt he had mostly healed from his parents' marital conflicts. Now things were better between father and son. The next night, Rhonda gave Andy a bottle of liquor for him to share with friends. He took it to a raucous party with dozens of other guests. They were all drinking, and so was Andy, heavily. When Rhonda came home in the early hours of the morning of December 24 after bartending, Andy became violently upset. They argued. Andy later said he picked a fight with her. I started yelling and screaming, he remembers, although he says he never would have tried to physically hurt her. Unable to explain his despondency, he tried to push her away, to build a wall between her worry and his despair. He could not explain his depression to anyone, not his father, his brother, his sister, or his friends. Intoxicated and agitated, he had reached the bottom of a deep, depressive pit. I just gave up on life right then and there. Angrily, He stormed upstairs and into his bedroom. He smashed everything he could reach. A mounted deer head he cherished, a TV screen, a picture of Al Pacino as Scarface on the wall. Rhonda retreated to her bedroom. Andy's rage continued, and at about 3 a.m., his spinning mind suddenly stopped to focus on the 7mm rifle he knew was in his mother's bedroom closet. He had thought about suicide in the past, but never attempted it. Like most people in his community, Andy owned and used firearms for hunting. Weeks earlier, he had stored them at a friend's house because he feared he would use them to harm himself, but he had since brought them back home. The thought of killing himself arose when he was angry or sad and frustrated at his inability to express himself. At such times, the idea, "I'd be better off dead," rose in his mind. Now, an impulse seized him. Andy burst into his mother's room shouting, "I hate you." Then he went for the closet. Rhonda later said she did not know the rifle was there. He grabbed the gun and returned to his own room. "I put a bullet in the chamber, and I'm crying and sobbing," he said. The way he saw things, he either had to get treatment for his alcohol dependency or kill himself. In his distress, those were the only two choices he could imagine. On the spot, he made an irrational choice. He felt so angry at the world that he stopped caring about his life. He wanted to get out. I remember looking down and thinking, "Oh, fuck it," he says. He sat on the bed and set the stock of the rifle between his legs and the barrel of the rifle against his chin. He squeezed the trigger. The world shook. His mother had followed Andy into his bedroom and saw the rifle fire. Andy's body rose from the bed and into the air before falling back down. She screamed in terror and found a phone. She told the 911 dispatcher, "My son is dead. He just shot himself." But Andy was not dead. After the blast, he remained semi-conscious, and the thought drifted to him that he had made an enormous mistake. He curled up on his bed and started screaming and crying. Then he dropped to the floor. He did not know how long he remained in this position or where his mother was. The bullet had shot away his nose, his jaw, and most of his teeth. Andy's mouth, or what was left of it, was unrecognizable. His eyes were seriously damaged. His first clear memory was of a childhood friend named Ryan Kearns standing above him. Kearns was a Newcastle police officer at the time. "Hey, man, are you all right?" was all Kearns could think to say, although it must have been clear that Andy was far from well. Andy, still crying, tried to tell Kearns he was in bad shape. He tried to say, "I don't want to die, Ryan. Don't let me die." But he could not speak the words, or any words at all. Kearns cradled Andy in his arms and tried to calm him. After a stretch of minutes that Andy could not measure, an ambulance arrived. Emergency medical technicians placed him on a gurney. When they brought him downstairs, he sensed that his mother was waiting in the living room. Andy wanted to talk to her, to apologize to her. He did not understand the seriousness of his condition. He only felt he had let his mother down, along with his whole family. The EMTs were busy staunching his bleeding and covering his wound. They knew there was no time to waste and rushed him to the front door. They needed to get him to a hospital immediately. I remember picking my head up and then looking at my mom and trying to say, "I'm sorry," he says. And then they took me into the ambulance. He became combative. The EMTs wanted to cut off his coat, which he resisted because he had bought it only recently. He struggled and pleaded with them to free his arms, believing he could remove the coat himself without them slicing it. The rifle shot had left Andy confused, frightened, remorseful, and unaware of his injuries. On arrival at the 18-bed Weston County Hospital in Newcastle, he underwent a computed tomography (CT) scan that, unexpectedly, showed no injuries to his brain. The bullet had committed vicious damage along its path, but it had missed the brain. Reed, who had received a phone call telling him that Andy shot himself and probably would not survive, rushed to the hospital. He entered his son's room and saw Andy with his entire head wrapped in bandages. The Newcastle physicians, recognizing that Andy's injuries were beyond their capabilities, were preparing him to transfer to a larger regional hospital in Rapid City, South Dakota, 78 miles from Newcastle. Upon arrival in Rapid City, Andy was still responsive to the voices of the hospital staff and could follow simple instructions. They also could see he needed more extensive emergency care than they could provide, and Andy spent only a couple of hours there. Andy received 2 units of red blood cells, a catheter to drain his urine, and a tetanus booster vaccine. The hospital staff packed and carefully rewrapped Andy's torn face. They moved Andy, now intubated so that he could breathe and in an induced coma, onto a waiting air ambulance with instructions to fly him over the state line into Minnesota. Andy arrived on Christmas Eve night at the Emergency Department of St. Mary's, part of the Mayo Clinic medical campus in Rochester, Minnesota. The head of the Division of Trauma Surgery, Scott Zeitlow, was on call that night. Over the years, Zeitlow had seen others come in with gunshot wounds like Andy's. Many did not survive, and many did not even make it alive to a hospital. None of the injuries was exactly the same as any of the others, but they all followed a similar pattern: loss of much of the lower and upper jaw, and severe damage to the lower part of the face. In many of these cases, because of the angle at which the firearm was placed against the chin, a reflexive tilt of the head from the impact caused the shot to miss the patient's brain. Even if life was tenuously preserved, the outcome was a tremendous amount of facial injury and damage. The loss of blood, risk of infection, and threat of complications were high. If Andy was to be like others before him, he might well die after arriving at the hospital. The emergency department staff unwrapped the bandages and layers of dressing underneath to examine Andy's face, and then covered him with warm blankets. Their first task was to give him a way to breathe reliably. An oral endotracheal tube was keeping his airway open, but one staff member had to hold it in place continuously because of the width of Andy's facial wound. Within 30 minutes of his arrival at Mayo, Andy was wheeled into an operating room to have a tracheostomy tube inserted a few centimeters above the collarbones. The tracheostomy would provide a more secure breathing line, bypassing Andy's mouth and nose to open a breathing hole in his trachea. Andy, although still unconscious, was sometimes reflexively agitated and a serious and immediate danger to himself. The staff placed him in cloth limb restraints. Once Andy's access to air had been ensured, he needed blood and lots of it. A new CT scan confirmed that his brain was uninjured. It also showed that the self-inflicted gunshot had caused extensive damage to the center of his face, including fragmentation of his upper and lower jaws, mouth, nose, and sinuses. Fortunately, the tongue was intact. The concussive effect of the rifle blast may have knocked it back out of the path of the bullet. In addition, his eye orbital bones and cheekbones were fractured. He suffered choroidal ruptures, breaks in the tissue in the middle layer of the walls of both eyes, as well as hemorrhaging in the left eye. Both eyes were swollen shut. The scan revealed bullet fragments in the middle portion of his face, plus pockets of air and fluid. It seemed incredible that Andy's brain had not suffered injuries. Another favorable sign: examination showed his vision was intact, although damaged. Zeitlow believed, considering the seriousness of Andy's wounds and his reliance on the full support of a ventilator, that Andy was doing reasonably well. Checking Andy's wounds, he found no active bleeding. His immediate plan for Andy, after ensuring adequate pain control, sedation, and antibiotic administration, was to make a magnetic resonance imaging (MRI) scan of the spine to ensure there was no damage to bones or ligaments. Next, and soon, should come an operation for an open gastrostomy in the abdomen, which would allow the placement of a feeding tube. There was no way he was going to be eating and drinking, at least in the foreseeable future, with the injuries he had, Zeitlo said. And you have to get him nutrition to heal and to live. Andy's gastrostomy was scheduled for December 26. While in the operating room, Mayo's facial trauma team would also examine Andy and determine additional treatment. Zeitlo obtained consent for the next day's surgery by phone from Rhonda, who, with her friend Kim Fulton and the family's chihuahua, was driving from Newcastle, Wyoming to Rochester, 9.5 hours away. 10 years later, when asked for an opinion on Andy's case, Zeitlo remembered his patient well. His experience with Andy on Christmas Eve in 2006 was impossible to forget, and Zeitlo still clearly recalled details of Andy's arrival. He said he routinely remembers his patients who die during their treatment, but other patients linger in his mind as well. Andy lives in Zeitlo's memory because of the devastating injury he'd suffered, the management of which was difficult, involving details and techniques Zeitlo continues to pass on to the next generations of surgeons at Mayo. Despite that high level of care, Andy would need to stay in the intensive care unit, ICU, for a long time. Andy had wild dreams during his first days in the hospital. In one, he felt desperately worried about his backpack. Had he lost it? Where was it? This dream flowed into another about football. On Christmas Eve, he had planned to watch an NFL game with his friend Kevin, a matchup between the Denver Broncos and the Cincinnati Bengals. I was dreaming that I ran out on the field and got tackled by Al Wilson, the Broncos linebacker, and he put me in the hospital, Andy remembered. Sedated and grievously wounded, Andy soon grew aware that someone was holding his hand. When he opened his eyes in his hospital room, his mother's face hovered close, with that of his sister Rhiannon nearby. Rhonda arrived in Rochester on December 28, and her drive to Rochester, navigated without cell phones or GPS guidance during severe wintry weather, had not been easy. Rhonda's expression, a look Andy will never forget, showed deep pain. Feeding and breathing tubes coiled into Andy's body. He wanted to speak to his mother, but his injuries made it impossible. Someone brought him a pen and a pad of paper. Hurriedly, he scrawled, "I'm sorry." Upon reading the message, Rhonda told him she loved him and that it was all right. She seemed to understand his pain and regret, feelings that had been urgently pressing in upon him, consciously and in dreams, since the moment he pulled the trigger of the rifle. But it was not all right for Andy or for Rhonda. His mother's words of understanding did not soothe Andy, whose emotions, despite the sedatives and other medicine coursing through his body, were in turmoil. Even worse than the strange sensations he felt on his damaged face were the agony and guilt he felt for what he had done to the people he loved. Nothing his mother could say would numb him to that pain. In the days before Rhonda's arrival, Zeitlo, after consulting with Mayo Clinic plastic surgeon Samir Mardini, made initial surgical efforts to clean up Andy's face, using suction and sponges to remove loose debris from the gunshot wound. Andy's lower jawbone was nearly all gone, along with most of the upper jaw. He no longer had a nose. Zeitlo picked out loose bone chips and cut away damaged tissue. He closed the wounds at the edges of the injured area and packed the open cavity of the face and sinuses when he was done. A new doctor, critical care surgeon Mark Sawyer, now started managing Andy's treatment in the surgical intensive care unit. Despite the appearance of Andy's horrific wounds, Sawyer expected his patient to survive. Aware that the records arriving with Andy documented his history of alcohol consumption, Sawyer directed the staff to keep watch for symptoms of withdrawal. Sawyer also worried about the effect of the grievous injuries on Andy's evident depression. He kept Andy sedated for most of the week, gradually lessening the sedation over time. Andy occasionally showed signs of consciousness, but remained mostly unconscious and dependent on a ventilator to take his breaths. That first week was not without challenges. There was a moment when Andy's arms and legs began shaking involuntarily, followed by more quaking in short bursts. A resident observed 2 episodes of jerky movements of the arms that lasted 20 to 30 seconds. Increased sedation halted the movements, which, to everyone's relief, did not return. Andy's physicians suspected the cause was paroxysmal autonomic phenomena, a movement disorder that sometimes accompanies trauma. An unrelated problem soon arose. Andy clawed at his feeding and respiration tubes, catheter, and facial bandages even while sedated. The staff continued tying his arms down with cloth restraints. When the staff explained why the restraints were needed, Andy nodded in apparent understanding. However, no one was sure how much Andy was comprehending or remembering. His agitation sometimes required additional sedation, such as when his facial dressings needed changing. Several times, Andy surprised Sawyer and the other medical staff by giving a thumbs-up sign. In contrast to his otherwise apparent lack of awareness, Andy's gesture appeared to give a different message. He seemed like he'd gotten a second chance, and he knew it, said Sawyer, who had anticipated that his patient would be less aware. By the end of Sawyer's week on duty, Andy was alert at times, looking around and making purposeful movements with his hands. Patient is beginning to wake up, Sawyer noted. We will continue to minimize his sedation and see how he does off ventilator support for the next 24 hours. By the first days of 2007, Andy was often alert, although painkillers continued to dull his awareness. He was able to respond to questions by nodding and writing. Luckily, his facial wounds were free of infection. Andy's eyes had been injured by the gunshot blast, but were still intact. His vision in his right eye was 20/30 after the gunshot wound, but the left eye had much worse perception. He sometimes had to wear a patch over the left eye at the hospital to help himself see clearly with the right eye. Fortunately, both eyes could move freely. The closure of his facial wounds restricted the use of his right eyelid, contributing to the risks to his cornea. Doctors treated Andy with ointment on both eyes while monitoring their hearing. By January 2, Andy was able to have something resembling a conversation with psychiatrist James Rundell, though Andy occasionally nodded off during their encounters. Nodding or shaking his head, Andy acknowledged that he had attempted suicide and that he had wanted to die when he shot himself. Now, he insisted, he wanted to live. Andy actually held out his hand for me to shake it when I asked him if he wanted to live, Rundell wrote in Andy's medical record. The staff should not worry that he would again try to take his own life, Andy asserted through gestures and head movements. He denied having hallucinations, delusions, illusions, or obsessive ideas. Andy was able to communicate that he felt no significant pain but did not know where he was. He seemed surprised to hear he was at Mayo Clinic in Rochester, Minnesota, Rundell observed. Andy consented to his mother making medical decisions for him for now. He still lacked the mental clarity necessary to make his own choices, but Rundell thought Andy might eventually need encouragement to take a more active role in his medical care. After his first couple of weeks in the hospital, Andy was sometimes able to sit in a chair. A social worker observed that although he could not speak, Andy appeared upbeat. In cases like Andy's, Mayo psychiatrists and psychologists typically recommend concealing serious facial injuries from patients until they express the wish to see them. Andy had not seen his injuries yet, nor shown an interest in doing so. Gently, as he grew more consistently alert, Andy's physical therapy began. His physical therapist presented modest goals for his recovery. Before his discharge from the hospital, she hoped Andy would be able to safely move by himself from his bed to a chair and vice versa, and she wanted him to be able to stand on his own. The therapist started a regimen of 5 to 9 treatment sessions per week. Although Andy still felt unsteady on his feet, he quickly began to exceed his therapist's goals. While Rhiannon was visiting, he took short walks around the ICU with her, around his room, a few steps in the hallway, and back to his bed. Each walk amounted to 50 or 75 feet. On one of these strolls, Andy caught sight of a reflection of his bandaged face in a window. The image haunted him. "I'm never going out of this room," he told himself in despair. "I don't want to leave. I don't ever want to see myself like that." Reliance on others for routine needs also bothered him. He resisted using the bedpan. On one occasion early on, when nature called, he attracted a nurse's attention and pointed to the bathroom in his room. The nurse said he was not yet allowed to use it. He scribbled on a pad, "I can walk over there." The nurse did not relent, and Andy used the bedpan unhappily. It was the last time. From then on, he was determined to totter over to the bathroom every time he needed to use the toilet. Using the bedpan was embarrassing to him. "Because all the nurses are looking at you, watching you. I'm a private person," he later said. But he grew to depend on the St. Mary's ICU staff. These weeks were a sad time for Andy. Anxious over his future, Andy occupied a dark hospital room with dimmed lights because of his sensitivity to glare. Mirrors were covered to avoid distressing him. The staff worked hard to improve his outlook and keep him moving. With Andy not yet seeing his face, however, his doctors and nurses were uncertain how much he understood about the damage his self-inflicted gunshot had caused. A physician observed that he was expressing a desire to eat and drink normally, which indicates that the patient is completely unaware of the extent of his injuries. During these early weeks of his treatment, Andy officially met the Mayo Clinic plastic surgeon who had been on call when Andy was admitted to St. Mary's, who had been consulted on his surgery of December 26, and who would be responsible for Andy's facial reconstruction. The surgeon introduced himself as Samir Mardini. 36, and with a tall, slender build, Mardini had a measured, gentle way of speaking, a high forehead, and kind, dark eyes. He looked at Andy when he talked to him. Andy was struck by the surgeon's calm demeanor and his ability to quickly grasp Andy's worries and needs. Neither of them realized how much their lives would intertwine in the years to come. Together, Mardini and Sawyer devised a plan for Andy's early facial reconstruction. Even though Andy's ability to pay for medical care was not yet established one way or the other, Mardini assured Andy that he would receive the best treatment Mayo Clinic could offer. "I just need you to be strong and patient," he added. As Andy later remembered, his mom told him, "Don't worry, Andy. They'll fix you up. They're going to fix you up."